viewers, my name is Dr. Sheidu Nasiru. I'm a consultant ophthalmic surgeon from General Hospital Ikorodu in Lagos State of Nigeria. Today, I'll be discussing the care of the eye. It's very important for us to take care of our eyes because not taking care of the eyes can lead to visual impairment and blindness. As we go ahead, I'll be discussing various things that can cause blindness, and it is very important for us to note that without vision, without good vision, and without eye, the world appears dark. And the quality of life of any individual with visual impairment or blindness can be highly compromised. So, visual impairment can result from various causes. Common among them include refractive error, cataract, glaucoma, diabetic retinopathy, hypertensive retinopathy, age-related macular degeneration, and injury to the eye. All these will be discussed in the course of this lecture. Visual impairment and blindness can affect any age group, being adult or children. So, as such, it is very important that we know what we should do and what we shouldn't do to prevent avoidable blindness. The World Sight Day is a day set aside by the World Health Organization in collaboration with International Agency for the Prevention of Blindness and also Lions Club International Organization. It's a day that is usually used to create awareness globally on how people can take care of their eyes to prevent avoidable blindness. It is usually celebrated on the second Thursday of October every year. And here in our center is not an exemption. We have carried out several free eye screening to the people and the environment. We have also performed free eye surgeries to the people in the environment. And this is in collaboration and a very big support from Lagos State government. The theme for this year is Love Your Eyes, as you can see boldly written. And if you love your eyes, there are some certain things you should do. And if you love your eyes, there are some certain things you should do to preserve vision and prevent avoidable blindness. Firstly, among those things we should do, I want to mention that having a regular eye check is very, very important to every age group. Being you adult or a child. For an adult, it is important that you have your eye check at least once or twice every year. Many people don't do this because probably they don't know the importance. But the way to do it is to prioritize your eye care. You can use it, a checkup, as a birthday gift to yourself. You can take it as a point of duty to have your eyes checked during your birthday. When you are on holiday, during your annual leave, you can use it to check your eyes. Before you enroll your child or your children into school, it is important that you take them for eye check because they could have refractive error. Now, these refractive errors can be corrected in them before they start school, which will improve the quality of their education. And for you as an adult, there are many diseases, eye diseases, that can cause loss of vision, which some of them in its early stage may not be easily detectable, not until you go for an eye check in an eye hospital that is manned by eye care professionals. Among those diseases that can be detected without you knowing include glaucoma, cataracts, refractive errors, which I have mentioned before, and there are some chronic diseases that are also associated with eye problems that can cause visual impairments. Example includes diabetes and hypertension. They are age-related. Then, if you can present yourself to a hospital, an eye care professional to check your eye, then there's likelihood that eye problem that would have caused blindness or visual impairment will be prevented. Another thing to mention here is those people that are on drugs, prescribed drugs, you must use your medication regularly as prescribed, especially if you are diabetes and hypertensive, you are on drug. If you are not compliant with your drugs, there is tendency that the diabetes and the sugar level, blood sugar level, will not be controlled. And as such, complications of these chronic diseases can affect the eye. You are a patient that has seen eye doctor, and eyeglasses have been recommended for you to correct refractive error. The correction mentioned to you is not just to use the glasses for some time and stop. You are expected to use it all the time when you are performing tasks. Some people make the mistake of stopping their eyeglasses, thinking that after using it for a period of time, the error should have been corrected. But that is a wrong impression. So using glasses is for the rest of your life if you have any need to use it, except you have done a refractive surgery which requires no glasses. Healthy diet consumption is another important way of preventing eye diseases. There are some certain nutritious foods such as vegetables, fruits, orange, carrots. All these contain multivitamins that are very good for eye. Some food supplements contain eye antioxidants, which is very, very good for the eye. Take your time to consume them from time to time in your balanced diet. Another thing you must always do is personal hygiene. Hand hygiene is very, very key, because if you rub your eyes, you happen to put your hand to your eye, you can transfer infection and problem would start. These are some of the things you can do to take care of your eye and have a healthy eye. Aside this, if you love your eyes, you are expected not to do some certain things. The first I want to mention among those things include avoiding harmful eye practices. Eye care professionals in most centers have found out that if people have eye problems, the first thing they do is to apply some of these harmful medications. Examples include the use of breast milk. Some people may even go as far as putting urine, their own urine, into their eyes. Urine is a harmful product which, by any means, after leaving the body, should not come back to that body. Some people can go as far as putting battery acid, water from the sea. Some people feel that this water is coming from the ocean. Because there's spiritual power there, they apply all sorts of things. All this will further damage the already existing eye problems. This is just to mention but a few. When you have an eye complaint, please try visit any nearby eye care center for proper examination, and you'll be told what to do on how to take care of your eye problems. In some rural communities, it was also observed that they do undergo couching. Couching is a procedure whereby somebody has cataracts. Instead of them going to a hospital, what they do is to visit a traditional healer that will now do something. What they simply do is just to remove, to dislocate the lens. The lens is part of the eye that's supposed to be clear and transparent, which allows light to pass through to the back of the eye for interpretation by the brain. But when they remove it, transfer it, they push it backward, what it simply does is that this patient may experience transient light, which was not there before, and the person will feel that something has been done. But the after effect is that the eye will eventually go blind. The ideal thing to do is to remove that lens by doing cataract extraction, during which an artificial lens can be placed back to improve the patient's vision. It is very important because people still do it up till today, which is the reason why this awareness is very, very important. Another thing to avoid to prevent trauma to our eye is using your prescribed glasses, eye glasses, all the time, and try to avoid trouble areas where people are fighting, where there is chaos. Never go there, especially if you have one eye. Never go and separate fight. We have had series of situations where people sustain eye injury at home in the course of trying to arrange some drinks in the refrigerators. Please, when doing all these things, be careful, because some of the cup of these drinks, when they explode, they come out with force to hit the eye, and the eye sustain injury. All these are part of what we should do, or what we shouldn't do, to preserve our vision and maintain a healthy eye. Particularly some of our guardians, the teachers, the parents, and other people who have been entrusted to take care of children. When a child does something wrong, the best to do is to advise the person and find alternative way of correcting that child, rather than using cane or some other substance, some other materials to flog the child. In the process of flogging, the child can actually dodge into the eye. We have had series of situations where a child sustained injury in such form. Please never use cane to flog any child if they misbehave. Another important thing to do for those people who are placed on eye medication, especially for glaucoma, we have discovered that some of the patients on anti-glaucoma medication, when they are using the drugs, sometimes they stop their medication because they are not expecting good outcome in terms of vision. It is good to note that glaucoma is a progressive disease which has no cure, but the essence of that medication given to you is to slow down the rate of progression. And how does it do it? It helps to reduce the pressure in the eye, and if the pressure can be maintained at a certain target level, that further damage will not continue to occur, there is likelihood that vision can be preserved for a much longer time than somebody that is not using medication. Please never stop your eye medication unless you are given instruction by the prescriber to stop it. If you are on any medication for some chronic disease like drugs for hypertension, drugs for diabetes, you have to comply strictly to those medications, because if you don't and your BP is not properly controlled and your sugar level, blood sugar level is not properly controlled, you are likely to develop eye complications of these chronic diseases, which I've earlier mentioned as diabetic retinopathy and hypertensive retinopathy. Another thing to observe is try to modify our lifestyle. Smoking and alcohol drinking have been found to be associated with some of the chronic diseases which I've mentioned, like hypertension, diabetes. We should try and avoid smoking and cut down on drinking habits. This is just to mention a few. We can't talk about everything. To crown it up, I want to mention that the take-home message here is that everybody should make it a point of duty to tie your eye care checkup with any important event in your life. It could be a birthday, it could be during your annual leave, or any other important event that do comes in your family. Add eye care to it, and not just you, to your entire family members. And by doing so, some of the eye diseases which ordinarily would have caused avoidable blindness can be prevented. Lastly, aside doing regular checkup, try to avoid all the harmful practices I have mentioned. They are real, it happened and it's still happening. When you have any eye problems, please try to present to an eye care center where you'll be properly seen by eye care professionals. And on this note, I thank you for listening, and please do continue to love your eyes. I wish you a healthy eye throughout your life. Thank you once again.